So I'm here with Dr. Manuela Kirberg from the Department of Philosophy and M3CS. How are you going today?
I'm good. I'm really happy to be here.
That's wonderful, wonderful. So today we're going to be talking about embodied care and some of the major ideas and how that can relate into medical care. As a broad overview, what would you kind of describe embodied care as?
I think it is really a shift away from seeing the body as an object to seeing like the body as a whole, as a subject body. And that also means a kind of different care. It means like not treating a patient as a body that you can like dissect into parts and see it as like the body as a mechanism, right? So we are like this body and we have limbs and then we have fingers and we have organs and then we have cells. But that is often not the experience of a patient. The patient is a whole. It's one whole subjective being. And so embodied care is, I think, really focusing on that aspect and treating the patient as a whole being. I think Merleau-Ponty, Maurice Merleau-Ponty is a French philosopher. He really emphasized this embodiment, this like the only way we experience the world is through our lived bodies, and we experience it as a whole, right? So I experience you and not like a color, a shape, a face. So yeah, it's really this embodiment in the world, the lived body, the full being I am. And it is also the body that entangles us with the world. So it makes us, it intertwines us with each other, with history, with everything.
Can you explain what you mean by that kind of like entangling there?
I think especially Maurice Merleau-Ponty was really radical when it came to, for example, perception. So perception usually is seen somehow as a passive act, like the body is an instrument, right? The senses, it's like some information coming in, getting interpreted. So Merleau-Ponty was he was like, there is nothing passive about perception. Perception is an active engagement with the world through your body. And that really means intentionality. So I see the world as already giving me possibilities to act on. It's very specific to my body, to my abilities. My body is in the world. And it's not just in the world, he says it's toward the world. So it helps us it orients the world to us. And this entanglement happens because in the end, Merleau-Ponty thinks everything is somehow connected at some point. And what actually anchors us within the world is our body, I'm touching this object. And at the same time, I feel the object, but I feel the touch. So the subject-object divide becomes like less pronounced in the lived body. It is one experience. And it also means perceiving. And that's the most radical idea, I think. Perceiving something or someone is participating in its being. So it's almost like I'm shaping you while I'm perceiving you at the same time. And I think this is really expressed in this entanglement.
Can you just expand on that point there about how being perceived by another, just I guess as you were saying there, is in some way building into that experience as well?
We always have this problem of other minds, right? So how do I relate to you? How do you relate to me? And this embodiment actually gives us a very specific answer to that. There is something that is pre-reflective. So to engage with you, to participate in your being, I'm actually not having to engage in a conscious act of simulating how you feel, analogy, inference. Merleau-Ponty actually thinks because we are both engaged in this world, because we're both embodied beings, we're not just a mind that lives in a body that goes through the world. No, I am my body. I am entangled. You are entangled. And that already connects us. And because we share this experience, we can perceive each other as subjective, lived beings. And that also means we have an incredible power, though, in this way of like understanding perception, to influence how someone else perceives themselves. And I think, Merleau-Ponty was really aware of this power of embodiment. And I think it becomes especially interesting in a medical context, right? But also because I think there the object-subject body becomes so prominent, this dissonance between I see you as a body, but I also see you as a subject. I am a subject. I am seeing my body not as this objective thing that I can measure and weigh. I feel myself here fully. And so I think there's really an interesting way in which Merleau-Ponty says there is a deeper connection between us that is deeper than words or concepts. It's already in our bodies. It's how we turn to each other. It's in our body language. It's in a way how we are both embedded and connected through embodiment in this situation. And that gives an extreme, like just the way how we, for example, turn towards each other right now is shaping our perception of each other, but also how we feel, right?
And that was going to be, I think, my follow-up question was, is something like body language a good example of how that way of, non-verbally and all those kind of things, and like you said, almost pre-reflexively, we influence each other in the sense that, as social creatures in particular, we're very finely tuned to picking up on these things, and so the smallest hints of where your eyes go, how your body is shaped towards me, will in turn cause me to feel a certain way.
Just imagine I would stare, right, at something like the whole time, and you would be like, what? Like it will turn your whole attention towards what's wrong with me, what is there? And that's, I think, in this tradition, Merleau-Ponty actually was fascinated by body language. He was like observing other people and how they connect, and he thought it is the most intimate, intuitive, pre-reflective way in which we're making sense of the world and ourselves. And so imagine that even when we talk about something like the medical gaze, right? So if you, in medicine, it is very interesting that medicine is always the example in which the objective body plays a role. And that makes sense, right? It's the body we measure, we can dissect and operate. It has a dysfunction somehow, but also there is this subjective body that comes with a problem. And even the first moment of the doctor-patient interaction is so important. Before you have said anything, before you have asked any question, if we already have this perception, I'm treating you as this body problem, this will change how someone feels. It will make someone feel either empowered or diminished. It will make someone be seen, or like if I'm just going in and like I'm like talking. So what's your problem?
I was about to say there's the flip side of that. Not only can our, like you said, with the gaze direct my attention. If your gaze isn't even on me, if your body language is totally deflected from me, then in some ways that diminishes myself.
Exactly. It makes you actually disappear. Imagine if we really think about this participating in your being. And this is why I think this embodiment is so interesting. It connects the individual to another person, but also to a whole system, a cultural system, a medical system, like history, right? Because we're all embedded, and the way how we treat each other, look at each other, dance with each other, all these things are shaping in like who we are in this lived body, how we experience our sense of self, I would say.
And in some ways as well, I think this can go beyond simply just being a kind of idea of, oh yeah, this is important because, we want students to feel, we want patients to feel a sense of connection with their doctors. But I think there's also a real power in that sense of, the observation of someone and the entanglement with them. We often hear these stories, particularly from experienced clinicians or nurses, how, they just knew something was wrong. There's nothing that can be put into words necessarily, but it's like, oh yeah, they're and if you push them, maybe they'd say something like, oh, their posture was a bit thing, or their breathing was a bit funny, or their color was a bit, but it's only by actually participating and being attentive to that person, you're able to pick those things up.
That is such an interesting example. That is really picking on that point. That is like, you observe the whole being of someone, and we pick up on the littlest things, and we have that a lot in like outside of the context, right? We have this like, there is something that makes me go away or go towards people. And often when you ask people like why, they're like, I don't know, but after a while it turns out there was some reason for that. And that's because we are incredibly good in reading the smallest details in body language. Yeah.
And then kind of on another note, this we've kind of talked about the entanglement with each other, but I think, body care was also kind of trying to give us the idea of, even with reference to ourselves sometimes, and particularly for a patient, oftentimes our own body can sometimes disappear away from us. And it's not until something comes along, illness, injury, to interrupt that we actually become then attentive to it. Is that a...
Yes.
Yeah.
Even Merleau-Ponty used illness as an example. And I think for very good reason. So the whole idea that the mind was in the center of philosophy of mind and Descartes and so on and so forth was that if we think about our consciousness right now, what are we conscious of? It's often thoughts. It's, even when I like take this glass and I drink, what I'm conscious of is like I'm thirsty. That's a thought. I am not conscious of, however, like what is not happening in my consciousness is I have to extend my arm, I have to curl my fingers, put pressure, lift my arm. This is not part of our experience, right? So Merleau-Ponty calls that pre-reflective awareness or pre-reflective intelligence, because we are born into this world with our bodies, with perceiving as little infants. We already learn how to manipulate the world, and all of this becomes habituated. So our body just functions. We just go up the stairs. We just drink that water. If you ask me, how did you drink the water? How did you do that? I'm like, I just did it. Like I'm not aware of that. So the moment, so it goes in the background, and what's then in the foreground is our mental life. I'm not aware how I'm breathing right now, my heartbeat. Maybe when I'm nervous, I feel my heartbeat, right? When I have asthma. So illness is an incredibly good example. Suddenly something disrupts. Suddenly I break a leg. I can't walk up these stairs. That also shows this embodiment, this access to the world, right? Because actually having something with my body is suddenly reducing the possibilities I have to engage with the world, to engage with others. And that has massive consequences.
I think, you just gave the example there of breath. And I think that's probably one of the most perfect examples, in the sense that breathing is something that is happening constantly. We are, for the most part, unaware of it until someone draws our attention to it. But especially then, thinking about illness and medicine, it's also one of those things that as soon as there is a problem with it or an interruption, it's something that almost cannot be escaped then, because it is so persistent in our lives. How do you think embodied care relates to that, or Ponty would talk about something like that there?
Yeah, I think this is, if you really understand, so there is this difference between a disruption of function, right? So this is what you would see as like the breathing. So you would go to a doctor, you would be like, I can't breathe, I have trouble breathing. And they treat that as a disruption of your normal functioning of your body. However, for yourself, it is a disruption of your being, right? Because suddenly if you can't breathe, if you have an asthma attack, every second is like, I can't breathe, I can't breathe. I can't even concentrate on doing anything else because I can't breathe. And that means I can't do a lot of other things. So especially when illness is incredibly disruptive, especially if it's chronic, really severe, it is not just an absence of normal functioning. It is changing the whole way how I am, my sense of self, how I can interact. And if I now think of that in a patient-doctor interaction, right? I have a patient coming to my office, and they are like, if I'm just asking them about symptoms, and that's what they usually do because they're trained to do that, right? They're like, yeah, I can't breathe, or I have a headache, or it hurts in my knee. Well, that is the disruption of function. But how does it affect you? How does it affect your life? You break a finger, maybe it's not a problem if you're like a marathon runner, but it is a problem if you're a pianist. So it is actually, as a pianist, you will break down. Your life, it would have such a massive effect on you and on your well-being and everything else. And so shifting the view away from a specific disruption of function to the perception of this disruption of function within the whole of the being, I think this is what embodied care, I think, really points out this difference. Also in asking different questions, I would say.
And I think that, that really plays into some ideas, of Foucault and the medical gaze and so on. And I think an interaction I kind of see there is, particularly as we gain access to more of these diagnostic tools and so on, and blood results and whatever it may be, there's no doubt a power in that, being able to diagnose and so on. But the more data that's in front of us, the more we have this technology in between us, that starts building this barrier. And then there's now this barrier between how we perceive each other and so on.
And the body, the subjective or the subject body disappears. I think this is in general in phenomenology, but also in all consciousness science. We are very interested in the first person perspective. And this kind of data is all third person perspective, is the scientific view from nowhere, the objective data. You can have all these examples of pain, of everything actually, right? How something feels like for us is very different than how it gets measured. See temperature, right? We have this very basic thing that you can perceive. The temperature in the room is the same for us, but I might be cold and you might be warm. But that is important, right? And it is important when we talk about care. I feel sometimes it might be good to have this distinction. It is okay on the surgeon's table to have the body object, the mechanistic body, to take it apart, put it together. That's the job. But in the care aspect of medicine, in the direct interaction, it is really, I think, really dangerous if the person disappears, because that's what we care about, how they subjectively experience illness and disease.
Yeah, certainly. And so I think, we talk a lot already in the students' training about the need to be attentive to your patients and be attentive to listening to stories and gathering a good history. And so I think, what to really reiterate this is not to demonize any of this technology or these diagnostic tools or anything like that. It's merely to point out, I think, as you were just saying, that, we shouldn't let that build a barrier or affect our perception of our patients and then the kind of interaction that builds between us. So I think one of the things that probably, brings a patient into the clinic is either they're in pain, or more times it's something a little bit more vague. It's I don't feel like myself.
Yeah.
What would embodied care have to say about that there?
So that is so interesting. I think this sentence, "I don't feel like myself," is such a good point in favor of Merleau-Ponty's view of embodiment. Because what do we really mean when we say that? We mean something is off, right? So and we have this in our daily life, just one night of having not slept well and we get up and we feel like our perception is slightly different, we can't focus as quickly, or our memory lets us down, we're just this is not me, this is not me. What is me? Me is this collection of habits, of things that run usually in the background, of things that I'm used to, the way I am, what I think about myself, of course. But the interesting part is that when we think about ourselves in normal conditions, we think about our beliefs, our thoughts, our attitudes. We think about the mind. But we go to the doctor and say, I don't feel myself if there's something bodily off. If exactly this body comes into the center of consciousness, because something isn't feeling right. And that is so interesting. It shows us that we actually forget all these mechanisms, all that running that our beautiful body does to us. And what we also don't often realize is that our body, because of this intentional opening to the world, because perception is always action, it also means all of this is part of my whole being extended in time. So while if I come to a doctor, they treat me as this body in moment. But if I come with I don't feel like myself, or even if it's something more I can't walk up the stairs, that is more than just walking up the stairs. It means I can't participate anymore in that life up there. I'm getting isolated from that. And maybe part of what happened up there, maybe my dance studio was up there, I don't know, was so much part of what I thought I am, who I am. Just brush your teeth with the wrong hand. It's like you suddenly feel, this is not my body, this is not myself. And that is so really interesting, because we actually learn that what constitutes our feeling of being ourselves is the functioning of all these little parts that make up our whole subjective traveling through the world in these bodies, in this space. And I think this is very, very interesting if you compare it to the mind section of philosophers like Descartes.
I think you just gave the example there of having to go up or not being able to go up the stairs. Yeah. Sorry. And I think if we take that a little bit back to how does that influence our interaction with others? I think there's an interesting point there, let's say you're with a group of friends, but you have a broken leg, or you're in a wheelchair, or whatever it happens to be. Now, they can go up the stairs, but you have to go to that lift, and you have to go in that lift, and you have to wait. Yep. And immediately, no doubt, you will feel this imposition of, oh, I'm holding people up. By that same token, you'll be hypersensitive to any kind of strange look from them or so on. So again, I think just to really emphasize, and then if we think about that in a doctor-patient kind of interaction, as a patient, you're going to be hypersensitive to anything, any little look, anything from the doctor.
Exactly. This is, I think, this hypersensitivity, if you talk to people who have also this change, an abrupt change. For them, it's this, because it is an abrupt change in being and self, there's a hypersensitivity to all kinds of things, right? Even, I think it also makes us aware that the environment is actually coming to us with affordances already. Because if I suddenly can't walk anymore, I realize all of these things actually require walking. My friends require me to walk, to hold up with them. Now I'm becoming an obstacle, something like that. Or that person, they did like this when they had to, wait for the lift. And so as a doctor, this is it is really difficult. You have a tight schedule, right? It is asking a lot from you to take a breather and be aware that the person who comes to you, for you, it might be a body you have to treat. For them, it's everything they are. It is everything they are. And they're there because they don't feel like themselves. They feel like something is off. And so they will be hypersensitive to anything you do, everywhere you look. And so I think a way out of that is not getting scared, right? It's not getting scared. It's just being aware that we all embodied beings. We are intertwined. We shape how we perceive and feel each other. We participate in each other's beings. And just being aware of my own embodiment might help for that, right? And it might help to think of them as subjective beings that they are their bodies, and something with them has changed. And so turning towards them like that, and not like the objective medicine body. And that's why it's so important in medicine. Your whole education is based on seeing the body as an object. And that is important because it's a mechanism we want to study. We want to know every part, and we want to know all the causalities and everything. And that's important. But then we have to make this cut. As soon as I talk to you as a person, you're not a mechanism. You're Ben, right? And I want to make you feel like Ben. So I think this is really important when it comes to that.
I think that's an amazing kind of message and call to action, I think, for them. So I just want to thank you for your time. It was a wonderful chat, and I'll look forward to seeing you in the workshop.
Yeah, thank you.